Hello everyone and welcome to UEG Week Virtual. I'm Geri Keane. I'm one of the Advanced Therapeutic Endoscopy Fellows at Johns Hopkins Hospital in Baltimore. I wanted to be a gastroenterologist. It really started when I was a junior doctor on the wards. I could see that it involved managing complex patients with really interesting pathology. I could see that intervention was a really important part of that. And when it's done well, it really improved the quality of life of patients. So it meant it was a specialty for me. I started my gastroenterology training in North London. I was mainly working between University College London and the Royal Free hospitals. I then took time out to do a PhD, and during that time I focused on novel diagnostic and therapeutic strategies for the management of cystic tumours of the pancreas. I think this was the first time I could really see the importance of combining research with clinical care. And also I had the opportunity to be involved in endoscopic research, and that really excited me. So then going back into clinical training, I did advanced hepatology training at King's College London, and stayed on to do their EUS and ERCP training. Then I've developed that further, coming over to the US to be the Advanced Therapeutic Fellow at Johns Hopkins. Currently, as the Therapeutic Endoscopy Fellow here at Hopkins, I split my time between the endoscopy unit and research. So on the endoscopy side of things, I'm having the opportunity to see things that are relatively rare in Europe, so it's more focusing on metabolic endoscopy, also anatomy, ERCP, advanced EUS, and third space endoscopy, which is really exciting. On the research side, I've had the opportunity to build on things I first really thought about during my PhD. So cystic tumours of the pancreas primarily, and I'm working with a cystic tumour group here led by Dr. Lemon. And this work forms the basis of our abstract to UEG Week, which is great. We all know that cystic tumours or pancreatic cyst is a very common clinical finding. They are of real importance as a proportion, carry malignant potential, and of course being able to detect these cases early offers a real opportunity for intervention in a disease with a dismal prognosis currently. However, differentiating out these high-risk lesions from all the other cysts that you see in the pancreas is a real clinical challenge. So what do we do here? Well, we see all of these patients in a dedicated pancreatic cyst clinic, and we discuss all the complex patients in a bi-weekly multidisciplinary meeting. And it's data that we've drawn from seeing all these patients in this dedicated service over the last 10 years that forms a prospectively collected data set, which we've now are describing some of the outcomes for in our abstract that we've submitted to UEG Week. No surprise that I'm going to say something about the pancreas here. I think I feel the pancreatic cancer really interesting. It's a really tough disease with a horrible prognosis, but I think over the last few years there's been a lot more investment and focus on pancreatic cancer, and what's really good to see is that there's real improvement in 1 and 5 year survival starting to come through now. I think there still needs to be a lot more work, and particularly around the early diagnostics, and that's what makes it really exciting. What does the future hold for us? Well, we now have a huge prospective database of clinically defined IPMN and lots of clinical questions that need answering. So I think we've got lots of work to do here, so exciting times. On a personal level, I've got my fellowship to complete, so I'm going to be busy for the next year, and then I'm looking to for an attending position, so that would be great. Thank you very much for watching, everyone. I look forward to seeing you at UEG Week Virtual. And please come and watch our talk on the natural history of IPMN.